Welcome. My name is Dr. Elizabeth Heath, and I'm a medical oncologist at the Karmanos Cancer Center. We understand that being diagnosed with cancer can be frightening and challenging. We're here to help. You'll be receiving chemotherapy as part of the treatment plan, and this video will give you the knowledge you need to prepare and cope during treatment. Chemotherapy is medication to stop or slow cancer cells from growing or spreading within the body or to relieve symptoms caused by cancer, such as pain. Upon conclusion of this video, you will understand how chemotherapy works, what to expect during your appointment, what side effects may occur, how to take care of yourself during chemotherapy treatment, and when to call your doctor and your team members for your healthcare needs. We hope you find this video educational and helpful. Should you have any questions or concern prior to your first infusion of chemotherapy, please contact your physician and nurse for any questions. Thank you and enjoy the video.
Chemotherapy is medicine that doctors prescribe to rid the body of cancer cells. Chemotherapy can be given to cure cancer. However, most doctors do not use the word cure anymore. Your doctor may say that you will receive chemotherapy to control the cancer, which means to stop or slow the cancer cells from growing and spreading. Chemotherapy can also be given to palliate or relieve the symptoms caused by cancer, such as pain. Traditional cytotoxic chemotherapy is designed to stop cells from growing and dividing along the cell cycle. Chemotherapy damages RNA or DNA to prevent cell division. If a cell cannot divide, it will die. Unfortunately, chemotherapy does not always know the difference between the cancer cells and the normal cells. Potential side effects that might occur happen because the fast-growing normal cells are being affected by the chemotherapy along with the cancer cells. Cells of the skin, hair, nails, mouth, throat, esophagus, stomach, intestines, and bone marrow may be affected by the chemotherapy. Potential side effects will be discussed later in this video. The majority of chemotherapy is given by intravenous infusion into a vein. However, chemotherapy may also be given as a pill, an injection or shot, or directly into or onto the cancer, such as topically on the skin, into the spinal fluid, or into a body cavity, such as the bladder. Some patients may need to have a central venous catheter, an implantable port, or a peripherally inserted central catheter, such as a PICC line, put in for their chemotherapy. These devices are connected to a catheter that will allow healthcare professionals to withdraw blood and or give fluids, chemotherapy, or blood products through them. Your healthcare team will let you know if you'll need one of these devices for your chemotherapy. Now we will review what to expect on the day you receive your chemotherapy. Receiving chemotherapy is a very precise process. Because your safety is our top priority, your chemotherapy is usually prepared on the day of your treatment after you've seen a member of your healthcare team and have had your blood work drawn. Your healthcare team must know how you're tolerating the chemotherapy and what your blood counts are before you receive treatment. Several appointments will be on your schedule the day of your chemotherapy and placed on your patient calendar. Your multidisciplinary team is headed by an oncologist. An oncologist is a doctor who specializes in treating cancer. Everyone on the team will work together to ensure that you receive the best possible care while you're at the Karmanos Cancer Center. Your primary care doctor is also part of the team and will be notified about how you're doing throughout your chemotherapy treatment. On the day of chemotherapy, eat your breakfast and, unless told differently, take your usual medications. When you arrive, check in at the Infusion Center desk. Before chemotherapy, your blood levels will need to be checked. Typically, blood work will need to be drawn before each treatment. However, for your first treatment, prior blood work may be used. Then you'll be sent to the clinic to see a member of your healthcare team. When the results of your blood work are back and the team assesses how you're doing, a decision will be made if you will receive your chemotherapy. If you are to receive chemotherapy, the orders are written and sent to the pharmacy. When the chemotherapy is ready, you're taken into the Infusion Center to receive your treatment. For your comfort, the Infusion Center has reclining chairs with privacy walls, curtains, or private rooms with a bed. Up to 2 guests can stay with you. However, for their safety, your guests must be at least 14 years of age. Dress comfortably in layers as room temperatures will vary. If you have a central venous device, wear clothing that will make it easy to access for blood draws and infusions. Your infusion nurse will start an IV and give you fluids, tell you approximately how long your infusion will take, give you pre-medications to help with potential side effects, give your chemotherapy, and monitor you for side effects. The nurse will also teach you about your treatment, possible side effects, and how to take care of yourself when you go home. While receiving chemotherapy, it is rare to have immediate side effects, but if you feel anything unusual, tell the nurse right away. During the infusion, you can keep yourself occupied by playing games, reading, listening to music, watching television or DVD movies. The Infusion Center has light refreshments, or you can bring your own snacks if you want to eat or drink. You can also use this time to do nothing and just relax. After the infusion, unless told otherwise, you will need someone to drive you home. The pre-medications you received may make you too drowsy to drive. You should update your patient calendar at the scheduler's desk to make sure that you do not miss any upcoming appointments. The remainder of this video will review potential side effects, how to manage these side effects, and when to call your healthcare team, and how the staff at the Barbara Ann Karmanos Cancer Center are here to help you throughout your chemotherapy experience.
It is important to remember that no two people respond exactly the same way when receiving chemotherapy, even if they are receiving the same chemotherapy drugs. Chemotherapy affects rapidly growing cells. Both cancer and normal cells can be affected by the chemotherapy. Normal cells that are often affected include hair, mouth and throat, esophagus, stomach and intestines, skin and nails, and the blood cells, including white blood cells, red blood cells, and platelets. Your healthcare team will discuss potential side effects with you. This does not mean that you will have side effects. If you do have them, tell your healthcare team. They will monitor you and help you manage them. You may be given prescription medication to help prevent or control side effects. If you receive prescriptions from your healthcare team, get them filled as soon as possible and take the medications as ordered. Call your healthcare team if you cannot get your prescriptions filled or if you are having side effects that are not controlled. Some of the side effects of chemotherapy may occur right after treatment. Some side effects occur much later in the course of treatment, sometimes months or years later. Early side effects include fatigue, nausea and vomiting, diarrhea, and/or constipation, as well as mouth sores. Blood cell counts may drop within 7 to 10 days after you receive your chemotherapy. Your white blood cell count helps fight infection. If your white blood cell count is too low, your risk for infection increases. If necessary, you may receive an injection to help increase your white blood cell count. During this time, you need to protect yourself from infection by washing your hands frequently and staying away from people who may have a cold. The red blood cells carry oxygen. A low red blood cell count is called anemia. If your red blood cells become too low, you may feel very tired. You may need to rest. If you feel dizzy or short of breath, call your healthcare team right away. Injections or blood transfusions can be given if your red blood cell count is too low. Platelets are the blood counts that form blood clots and help you stop bleeding. Decreased platelets can increase your risk for bruising and bleeding, so be careful. Don't cut or injure yourself. Use an electric razor, and if you cut yourself while your platelets are low, clean the cut right away, apply a bandage, and pressure for at least 5 minutes. If the bleeding does not stop, call your healthcare team. Transfusions may be given to increase your platelets. All chemotherapies do not cause hair loss. Your healthcare team will let you know if this may happen to you. If hair loss is a potential side effect of the chemotherapy you are receiving, it will usually occur about 3 weeks after the first treatment. Remember, hair loss is a total body hair loss, not just your head. That includes your eyelashes, your eyebrows, leg hair, underarm hair. So you need to plan ahead. Buy hats, wigs, scarves, anything you may need to help protect your scalp. Wear eyeglasses to prevent debris from blowing in your eyes, especially on those windy days. After chemotherapy is complete, the hair will usually grow back in about 6 weeks. Often, it is different than what it was before you lost it. Some medications can affect your vision. Tell your healthcare team if you have changes in vision, such as blurred vision, dry eyes, tearing, redness, or sensitivity to light. These changes are often temporary, but should be reported right away. Do not buy glasses or contacts until your treatment is complete, as often the vision will go back or change completely after treatment. Sometimes hearing changes can occur. It often is based on the medication that you are taking. Let your healthcare team know if you're having any hearing changes. You may need to be checked by an ears, nose, and throat doctor, called an ENT, if this is very severe. Patients often complain of experiencing poor memory or difficulty concentrating. It's often called Chemobrain. Let your healthcare team know right away if you are experiencing this. Chemobrain is often temporary, and your memory should return to normal after you've completed chemotherapy. Some ways to manage it are to write things down, which you can use a symptom log in your patient portfolio, and try to avoid difficult tasks while you're receiving treatment. Certain chemotherapies can affect the peripheral nerves. This is called peripheral neuropathy. Your healthcare team will let you know if you're receiving one of those drugs. Some of the symptoms include numbness, tingling of the hands and feet, loss of sensation to touch, difficulty picking things up, unrelieved pain, and constipation. Notify your healthcare team if you're experiencing any of these above symptoms as soon as you can. Things you can do to decrease the effects of peripheral neuropathy include not walking around without the proper footwear, avoiding extreme temperature changes, using gloves when you're cleaning things, washing dishes, and gardening, and using pot holders when you cook. So what do you do if a side effect occurs? Well, the first thing you should do is let your healthcare team know. They will work with you to help monitor and manage your side effects. The other thing you can do is refer to the suggestions in the Receiving Chemotherapy at Karmanos, the insert inside of your patient portfolio. Let's discuss about when you should call your doctor. Call the doctor if you're having any of the following symptoms of infection, such as a fever of 100.5 or higher, shaking, chills, or sweating, flu-like symptoms such as muscle aches or pain, a new cough or a sore throat or one that is getting worse, phlegm or mucus when you cough, abnormal vaginal discharge or itching, a new rash, sores or white patches in or around your mouth or anywhere else, redness, drainage, swelling, tenderness, or pain anywhere. Call your healthcare team if you have nausea that is not relieved by medication for more than 24 hours and the nausea is preventing you from keeping down your fluids and medication. Vomiting more than 4 times a day, diarrhea, loose or liquid stools for more than 24 hours, constipation, no bowel movements, or hard stools for 1 to 3 days, problems urinating, including burning or pain, cloudy urine, changes in color or odor, or a decreased amount, mouth sores or pain with swallowing, or problems sleeping or fatigue after taking a nap. Call your healthcare team immediately if you feel dizzy, have difficulty breathing, bleeding from anywhere, including blood in your vomit, urine, or stool, uncontrolled pain, or sudden confusion. Use your patient portfolio to help you stay organized. Refer to the Taking Care of Yourself section in the patient portfolio to help you manage side effects. Also use the section to refer how to contact your healthcare team. Use it to keep the business cards of all those who are involved in your care. And remember, you can always call the 1-800-Karmanos number if you have any further questions.
Tell your healthcare team about all your medications, including over-the-counter drugs, vitamins, and herbal medications. To decrease the risk for infection and bleeding, routine dental cleanings should be done before you begin chemotherapy. As chemotherapy moves through your body for the first 48 hours, it is broken down and eliminated in your body fluids, urine, stool, and other body secretions, including sweat. Because your body fluids contain chemotherapy, it is important that you do not expose anyone to your body fluids. Your nurse will let you know if your chemotherapy will take longer to be eliminated from the body. For 48 hours after treatment, Contain or clean up all body fluids right away with disposable paper towels. Dispose of or wash soiled items in the hottest temperature as soon as possible. Double flush the toilet and keep the lid shut. Wash hands immediately after contact with body fluids. Wear barrier protection during sexual contact. Avoid contact of body fluids with children or anyone who is pregnant or nursing. Keep an updated list of all your allergies and medications and carry it with you. Let your doctor know if you start any new medication or treatments, including over-the-counter medications, vitamins, home remedies, and herbal products. One of the best ways to decrease the risk for infection and maintain healthy skin is to wash your hands often. Shower, bathe, or sponge bathe every day and moisturize your skin gently and often. Tips for nail care include: avoid cutting your cuticles and do not wear false nails. Both will increase the risk of infection. You should keep cuticles moist and pushed back. You can wear nail polish if you like, but only use non-acetone polish removers. When you go to the nail salon, take your own manicure-pedicure supplies with you. Avoid routine dental cleanings. Brush your teeth with a soft bristle toothbrush at least 2 times a day. Continue to floss if you already floss. If you do not floss, check with your doctor before starting to floss. This may cause unnecessary bleeding. To decrease bacteria in the mouth and infection risk, rinse your mouth 3 times a day for up to 3 days after treatment with a salt water mixture or baking soda mixture. Do not use regular mouthwash. Alcohol-based mouthwash will dry out your mouth. To make this solution, mix half a teaspoon of salt or half a teaspoon of baking soda with 1 cup of warm water. Swish in your mouth and then spit it out. Eat as nutritiously as possible. Try eating smaller, more frequent meals. Avoid spicy and greasy foods. Avoid foods with strong odors. Avoid extreme hot or cold foods. If needed, ask for a referral to our dietitian. Drink 6 to 8 8-ounce glasses of fluids every day, water, juice, or other liquids. This will help keep you hydrated. It also will improve the way your kidneys work. Ask your doctor about occasional alcohol use. If you smoke, quit now. This is especially important during chemotherapy. Smoking will decrease the effectiveness of many drugs. It also increases the chance of infection, interferes with healing, weakens the immune system, and increases chance of cancer recurring. The Michigan Tobacco Telephone Quit line can help you quit. Ask for a referral or call 1-800-QUIT-NOW. Try to continue your usual activities, work, exercise, and leisure, when possible. While strenuous activity is not recommended, regular light exercise like walking is important. When balanced with rest, staying active has been found to decrease feelings of fatigue. If you plan to travel, let your doctor know. During chemotherapy treatment, your skin may be more sensitive to sunlight. Apply a 30 SPF or greater sunscreen to all exposed skin. Reapply every 2 hours when outdoors. Wear sunglasses, a hat, and other protective clothing when outdoors. It is important to rest when you need it. Take naps. Let us know if you're having trouble sleeping. Ask for help if you need it. Your family and friends are there to support you. Let them help. Karmanos has a symptom management specialist to help you. Ask for a referral. Do not get pregnant. Cancer treatment will harm an unborn baby. Cancer treatment can cause sterility in men and women. Talk with your doctor before starting treatment. Sperm banking or freezing eggs is sometimes possible. Please ask questions. There is no one right way to cope with cancer. Many people who receive chemotherapy may have feelings of sadness, anxiety, depression, or isolation. If you have these feelings, you are not alone. We are here to help. Remember, the staff at the Barbara Ann Karmanos Cancer Institute are here to help you and your family throughout all phases of your treatment. We have supportive services and complementary therapies, including individualized teaching and classes, support groups, and peer-to-peer support, social work services, symptom management services, referrals for supportive resources such as hair loss and post-mastectomy needs, complementary therapies including massage therapy, art, music, and pet therapy, financial and transportation assistance. Please call 1-800-Karmanos for more information. Bring your patient portfolio with you to all appointments. Keep an updated record of your medications. Remember, there are ways to prevent and manage the side effects of chemotherapy. Talk with your healthcare team about how you are doing, including symptoms, side effects, and coping, questions or concerns, and please let us know any changes in or problems with your medications. Ask us for help. Use our resources if you need them.